Adults and kids alike experience feelings of anxiety, fear, and nervousness. And some of those feelings for kids come from recent events across the country. While these feelings are natural and can actually help keeping us safe and motivated at times, anxiety becomes a larger concern when it stops a child from doing things that they want to do or things that they need to do. And Maddie Breer and Sabrina White, both psychiatric nurse practitioners with Ascension St. Vincent, are here this morning with help with children who feel anxious. And this is something that we see so much now. I think every day we're hearing more and more about this. And Sabrina, I want to start with you and talking about anxiety and how it looks so different for so many different people in different age groups.
Absolutely. So for younger children, a lot of times anxiety presents itself as not wanting to separate from their caregivers, not wanting to go into social situations, and stomach aches and headaches that a lot of times we do a medical workup, and it's really anxiety. Then when they get a little bit older, they're avoiding social situations and not wanting to go to school or complete homework because they're for fear of it's not perfect and it's not right.
And then as they get even older, we start to see
Absolutely.
it look even different.
Yeah, even with the teenagers, a lot of times there's the peer groups, refusal of school, and then parents looking at their social media and starting to notice perhaps that there's some conflict going on with their peer group.
Okay, Maddie, jump in here. What do we do and how do we actually have that conversation? We talk about this a lot on our show, how to have the conversation. There's a lot of different ways to have the conversation. We like to bring different people in. How do you suggest that parents do that?
Yeah, well, I think it's really important to, validate your kids. Say things like, wow, that presentation at school, that seems really scary. And really validating our kids, giving them that language to call it anxiety, call it stress, means like you're more likely to have that conversation moving forward and they're going to talk to you about it.
Yeah, how do you think that you actually start that conversation? Let's give people that are watching that like perfect example right now. You're maybe in the car. Driving home from school. A lot of times they don't want to talk right away, and you ask them, how are you? What's going? Fine, nothing. What do you guys suggest?
Yeah, well, I think it's important, like I said, to maybe lead with that assumption and say, wow, it sounds like you've got a lot going on at school. That seems like it might be kind of overwhelming. I think rather than asking the question, how are you or what's going on, you kind of start with that validation and allow them to carry the conversation from there.
Yeah, I think still, at least how I grew up, it was very much, it actually worked for me. So I'm not downplaying this, but it was like, you need to get thick skin, you need to toughen up. But that doesn't work for everyone, right? And I think sometimes if you're not being validated or parents maybe don't know what to say, it can perhaps make it even worse.
Absolutely, yeah.
Well, and a lot of times with the anxiety, when we don't confront it, there is a part of it that we need to move through it because it gets bigger if we don't actually move through it. But letting kids know that you're there to support them as they move through that anxiety and say, I'm here with you, but we do have to tackle it, that makes that anxiety grow or diminish.
Yeah. So we're going to jump in here for this last minute and tell us, if there's somebody watching right now that they know that this is happening, what do you suggest? And if somebody comes to see someone like you, what does that look like? It can be scary, or people think it means there's something wrong, and it's like, no, it's just an opportunity to learn what's going on.
Absolutely. So they can come on to the St. Vincent Stress Center and do a crisis assessment. And a lot of times those counselors will help walk them through resources. Just because they come to the hospital doesn't mean they need to go to the hospital. And they'll give them resources and phone numbers to call and therapists in the area that are accepting new patients and have that evaluation to talk through.
We see that too, where I've heard several times where the wait list has been long. How do you see that? Is it and the need for therapists and counselors and psychiatrists and social workers? Do you feel like we're getting back to kind of where we need to be, or is there still a lack of therapists?
I think there's definitely still a need. I think the pandemic obviously delayed care and increased the level of care. But, coming good contacts and relationships, particularly with the schools and with different mental health centers, there are people available. It's just finding the right ones.
Well, we appreciate you both, what you're doing. I know it can be very busy and overwhelming, so good to have you both here.
Thank you.
You're welcome. 8:46 right now. Not as serious as when you need to get help. But Jim, I know your family right now, you're going through a lot with high school graduation and college decisions and roommate decisions.
There is a long list of things that need to be taken care of in the days ahead. Thank you, ladies. 8:46 out the door right now.